Hi, my name is Tony Andy Oliveira, and I'm going to be presenting Understanding Forceful Letdown and Oversupply and the impact that it may have on the breastfeeding chest feeding relationship for the lactating parent and their baby. Some of the items that I will be discussing today are as follows. What is a forceful letdown? Oversupply and the symptoms of, the impact that it may have on nursing, management of these symptoms, and support techniques for those that may need it. So, breastfeeding is an organic and highly recommended method to provide infants with essential nutrients and foster a profound bond between the parent and their baby. However, some lactating people may encounter forceful letdown and oversupply issues, which can pose challenges and lead to discomfort for both the parent and the baby. It is crucial to comprehend the underlying reasons behind these difficulties to address them effectively and ensure a positive and successful breastfeeding experience. So, what exactly is a forceful letdown? Forceful letdown is a term used to describe the swift and vigorous flow of milk that occurs during nursing. This can often result in an abrupt and forceful ejection of milk from the chest, which may be uncomfortable or distressing for the baby. As a result, the baby may struggle to keep up with the flow and may exhibit signs of discomfort or frustration during feeding. This can be a source of concern for parents who may feel powerless to help their baby. It is important to address these issues early on to ensure the comfort and well being of both the baby and the parent. Forceful letdown is primarily caused by an overactive milk ejection reflex, which releases milk more forcefully than the baby can actually handle. I'll be sharing some tips on how to lessen the stress and make it a more comfortable experience for both the parent and the baby as I delve deeper into the presentation. Oversupply during lactation, also known as hyperlactation or hypergalactia, occurs when a person produces more milk than their baby needs for nourishment. The abundance of milk can lead to some challenges, though. Babies may struggle to keep up with the fast flow, leading to choking, gulping, or even refusing to nurse. Where for the lactating parent, they may experience discomfort, engorgement, or an increased risk of blocked milk ducts and even mastitis. For the baby, forceful letdown and oversupply can have short term and long term effects. In the short term, the fast milk flow can make it difficult for the baby to coordinate their suck, swallow, breathe pattern, leading to frustration, poor and shallow latch. This can result in inadequate milk transfer, causing weight gain issues, and sometimes leading to the preference of a bottle, especially for those that pump regularly. Additionally, excessive milk intake can cause colic like symptoms, gas, frequent spitting up, frothy green bowel movements, and excessive weight gain in some babies. Those experiencing forceful letdown and oversupply may face various challenges as well. The forceful flow of milk can cause discomfort, pain, and even nipple damage. In addition, if not managed properly, clogged ducts and mastitis is also a risk factor. When consistently producing milk, it's common to feel overwhelmed and exhausted. To help alleviate any discomfort and ensure a steady milk supply, it may be necessary to frequently use a breast pump or even manually express milk, which can also be exhausting for the lactating parent. So, let's discuss some of the techniques that you can use to manage oversupply and this forceful letdown. When dealing with a forceful letdown and oversupply during chest feeding, it's important to implement personalized management strategies. Try nursing positions such as side lying or the laid back starter position, which can be beneficial in allowing babies to regulate the milk flow through latching and unlatching as needed. This method helps to decrease the intensity of forceful letdowns. You can try latching your baby on and then latching them when the initial rush of milk slows down. This can help them handle the flow better and reduce the chances of choking or gagging. Remember, by adding frequent breaks to burp will also allow for pace feeding. Block feeding is another technique that can be quite useful. It allows for the baby to feed on the same side for a prolonged amount of time. For example, if the allotted time is 3 hours, you would feed the baby on demand from the same side for those 3 hours, and then switch sides for subsequent feedings for a block of 3 hours. Block feeding helps signal to the chest that less milk is needed, leading to a gradual decrease in milk production over time. In addition, by consistently feeding from one side for a longer duration, the baby is able to consume the hind milk, which is richer in fat and helps promote fullness. This can help prevent the baby from becoming overfed and reduce the risk of experiencing discomfort from the excessive milk intake. In addition, try expressing some milk before latching the baby. This can help reduce the force of the letdown. In the event that excessive milk production becomes unmanageable, there are certain herbs and supplements that can aid in the reduction of milk. Remember, every breastfeeding journey is unique, and what works for one person may not work for another. It is important to experiment with different positions and techniques to find what works best for you and your baby. If you continue to have difficulties with a forceful letdown, you should consider consulting with a lactation specialist for personalized guidance and support. For those that pump and have a surplus, donating human milk can have a positive effect on the donor's health when they struggle with an excess supply. Not only can it alleviate common issues such as engorgement, mastitis, or clogged ducts, donating milk can be emotionally fulfilling for the donor. Knowing that their contribution is directly helping babies in need can provide a sense of purpose. It creates a sense of community and solidarity among parents, fostering a supportive environment for one another. While forceful letdown and oversupply can present difficulties in the breastfeeding journey, they are not insurmountable. By understanding these causes and the impacts and the management strategies, parents can overcome these challenges and can continue to provide their babies with the nourishment and comfort for breastfeeding. With the right support and information, the lactating parent can navigate forceful letdown and oversupply, ensuring a positive and rewarding breastfeeding experience for both themselves and their babies. Thank you for listening today. As always, if you have any questions, please feel free to contact me.